And they've had a lot of problems in Health Connect, as everyone well knows. And we've been alerted to 2 more possible new problems that will be coming up. Some of the calculators were wrong that people who were navigators were using. There's been some inaccurate information. And if you are filing with the IRS, as in the front page on here, you may have wrong information and people may either owe money or get money back. Giving back money is never a problem, but if you owe money, sometimes there's penalties attached, and we're not certain whether the federal government's going to push those fees on to people.
Well, yeah, they are. I mean, they are. There are some limits. There's some cap. This was a great idea of Doug's to pass this out, because you are going to be getting constituent calls because they are going to be stunned because they're going to get in the mail something that's going to tell them they owe the IRS money. Not everybody.
Right.
And they could have done everything right, but because our system wasn't running up and running, when they sent in change of circumstances the way they were supposed to, those are all being manually processed. So some of them may not have even been processed yet. So through no fault of their own. Also, as this references, they may be getting multiple information sheets because there were more than one change of circumstances. And they'll think, oh, another copy. They're not cumulative. They need to keep and have every single one to attach. So there are a lot of problems that are going to come up. And so,
I think they would be. But the second part of this issue is there may be people, because the calculators are wrong, who are signed up under the Obamacare, basically, and under the subsidies, who will not be qualified. Because the calculators are wrong, they thought they were qualified, will not. They will be either kicked off the program or asked to pay back some payments on that, or both. And that may be coming out soon.
and also we were informed that if people call the IRS hotline or taxpayer line for help and advice, there was a big budget cut. They're expecting to only be able to receive and help 50% of the calls they get. So that's not going to be
In the past,